Hey everybody, Dr. Deom here at Hazleton Eye Specialists. I am very excited to have another episode of Eyecare today. We have a very special guest with us today. Very excited to introduce him in just a moment. I want to remind you about where we are. We are located on the Airport Beltway in Hazel Township, PA. That's 281 Airport Road, Hazel Township, PA. You can't miss us. We're at the Big Eyeball in Hazleton, so check us out. We are in Tannersville, very new location in Tannersville, Stroudsburg Eye Specialists. That's 2942 Route 611, right behind Friendly's on Route 611. Can't miss us there. Beautiful new location. And very exciting, Schuylkill County, you've been waiting, and we have listened and heard you. We're coming to serve Schuylkill County and beyond at the newest location for our practice in Pottsville Eye Specialists. It's going to be at 541 Bacon Street. You can call and make an appointment today. Make that appointment ready for the end of 2020. We're very excited. We have a brand new doctor there and offering all of the advanced eye care that we offer in our other locations. So, without further ado, I have a very special guest here with us today. You all know him. You've seen his face different places, and maybe you've even met him in person, Dr. Frank Bucci. Dr. Frank Bucci, of course, is a world-renowned ophthalmic surgeon and ophthalmologist, and we're very proud to have him as part of our practice here in Hazleton, Stroudsburg, and in Pottsville. So thank you for joining us here today. One thing that I wanted to bring up about you, because I think a lot of people know about your surgical skills and your experience in eye care, but I don't think everyone knows about your passion for end-of-life care. So would you mind giving me a little bit of background there?
Okay, I'll just spend a minute on that. I was the founder, originator of Hospice of the Sacred Heart right here in Northeast Pennsylvania. We started out just in Lackawanna, Luzerne County, but now we serve 9 counties. It's been about 17 years that we've been open and taking care of about 18,000 end-of-life patients. I'm the founder and chairman of the board now and a volunteer. The 80 or so nurses that we send to 9 counties, they make me look good, and I get a lot of credit for what they really deserve. But appreciate the mention, Doctor.
Well, that's an amazing thing. I think there's a lot of things you could have done with your time and a lot of things that you could do with your passions and the gifts you've been given. And to say that you've done that is, I think, a real impressive statement. And, you know, a lot of times I see patients here in the office, patients that need surgical care, whether it be for cataract or LASIK, and or glaucoma, which we're going to be talking about today. And patients will ask me, you know, who would you send your mom to? Who would you send, you know, your loved one to? And I don't hesitate. I don't blink. I don't really think 2 thoughts about it, and I recommend you. I think what you just said really speaks to why I do that. A real person with a real passion and compassion, and I think that's, you know, displayed in you know, your life's work. And so thank you for offering your services to this area. It's very important to us. So we're going to talk about glaucoma today.
Okay.
Not something that we've talked about here on the show before.
Okay, that's good. Good, something new then.
Yes, that's right. So glaucoma. The beginning of glaucoma, I think, is really important, and many patients are being treated with eye drops for glaucoma. Glaucoma eye drops present a myriad of concerns.
Yes.
What are some of those concerns?
Okay, that's a great point, Doctor. So, you know, we've been using drops to lower the pressure in the eye because that's really the treatment you want to do with glaucoma. So I've been doing this for 35 years, and you know, we use the drops, and all drops have, for example, preservatives. Plus, there's a medicine in there, and that can affect the cells on the surface of the eye. You might think of it can cause a kind of dry eye and challenge the person's health more than just a mild dry eye, because you have to use these drops for a lifetime. Because if we don't get the pressure down, you're going to go blind. So we have some things to talk about today here that may free us from the drops, which is very, very important. So we want to not have to take those drops with those preservatives for a lifetime.
Absolutely, and I think, when I look at dry eye, something that we are very passionate about here at all of our offices, and so if you or a loved one is walking around with red eyes, they're peering red, they feel physically unnatural, itching, burning, scratching, or they tear excessively, you may be suffering with dry eye disease, and this is something that we should be taking a look at. But if you're taking glaucoma drops, there's a very high likelihood you're suffering from dry eye, and these preservatives you're talking about are a major cause.
Right, especially as as we get older, the incidence of glaucoma increases the older you get, and dry eye increases the older you get. So you would have that either diagnosis independently, but they're actually ones making the other one even worse.
Absolutely. Are you being ageist? Are you saying that only old people can get glaucoma?
Well, when you're my age, you can go ahead and get away with that.
I'm just kidding. No, but you're absolutely right. I mean, glaucoma is going to be something that you're going to see more often when you're advancing in age. But there are technologies that we have here in our office, and we're very proud about these technologies that help us diagnose it and ultimately treat it much earlier. Things like OCT, which scans the optic nerve, and I'm just going to go real quick into what we're really looking at with glaucoma, and that's a very important tissue called the optic nerve. And I often tell patients it's the electrical cord that plugs into the back of your eye, travels to your brain, and allows those two things to communicate. And eye pressure, which you spoke about, is ultimately what we believe can damage that. How do you explain optic nerve and glaucoma to patients?
Well, I try to tell patients that inside your eye there's cells that produce fluid. So I call that the faucet. And then they travel a certain course in the eye, and then they exit what we consider like the drain of the eye. Now, glaucoma is a disease of the drain where it doesn't let the fluid out quickly enough, and then the pressure starts to build up, and that presses on that special tissue you call the optic nerve, begins to kill off the nerve fibers. And something you really need to know, you can lose half of your optic nerve, but it steals the vision from the side. And you can lose half of it without even knowing it. It's kind of like having high blood pressure and you're walking around with it, and all of a sudden you have a stroke. It's doing damage, but you don't know it. It's like the silent killer hypertension. This is the silent blinder in that glaucoma. Slowly takes your vision, but it does it so slow that you can lose half of it before even knowing it. So that's just a little plug that you need to come in. Everybody needs to have their pressure checked at least once a year, and then obviously glaucoma patients will be checking much more frequently.
Awesome. So on the other side of this break, we're going to talk a little bit more about some of these advanced treatments that are really first of their kind, very exciting, and some only being offered here. Hazleton Eye Specialists, Stroudsburg Eye Specialists, Pottsville Eye Specialists now, and thanks to our partnership with Dr. Frank Bucci. Hey everybody, we're back and we are getting through this wonderful episode about glaucoma. We have Dr. Frank Bucci here with us today. Very exciting to talk to him about all the new advancements we have to offer when it comes to advanced glaucoma care and glaucoma care in our area. I want to let you know where we're at. Hazleton Eye Specialists. We're in Hazleton, Hazel Township more specifically, on the Airport Beltway, right by the Big Eyeball. You can't miss us. Down the road from Walmart. Very easy access, large parking lot, following all of the CDC guidelines, very comfortable environment. And in Stroudsburg, we have Stroudsburg Eye Specialists. In our new location, actually Tannersville, right behind Friendly's, 2942 Route 611 in Tannersville. And our new location, so exciting to be bringing our eye care and our passion for all things eyeballs to Schuylkill County. Very exciting. I know there is a great need in the Schuylkill County area. My wife is originally from Williamstown, Lower Schuylkill County, and I have several extended family in Coltmont and Mount Carmel, and we're very excited to be offering our eye care services to this region. Give us a call, 570-628-EYES, to be scheduling an appointment for our Pottsville office. We're very excited to see you there soon. So we are talking about glaucoma, and not something we talk about all the time, right? We're usually talking about cataracts, LASIK, something you do quite a bit of, right?
Right.
Let's just talk about cataracts for a second.
Okay.
All right. So how many cataract surgeries have you done overall?
Only 31,000, Jim.
Did you stop counting after 39, 31,000?
After 30. It might be 32, but I'm saying 31.
I mean, no joke. I mean, he could do it with his eyes closed. I've had the great and distinct pleasure of observing, Dr. Bucci perform, this really miraculous procedure, which has come so very far in a very short period of time. Do you still get excited when you do a cataract surgery?
Actually, I do. I mean, I've had colleagues who say, "Oh, it's the same thing over and over again," but it's really not. Each patient's a little bit unique, and I think it's very exciting just to have the privilege to go inside someone's eyeball and to extract that thing that's opacifying their vision. I mean, I don't want to offend insurance surgeons, but people tell me, you like what you do, and I always say it's better than selling insurance. I mean, making someone see is really exciting, especially when you get into like multifocal lenses, and we're free. Out of my 31,000, almost 9,000 now, can see distance, intermediate, and up close, and have no glasses at all. And they make our list our no bifocal honor roll. So we like patients to be excited about being on the honor roll.
I just had a patient today, a very high nearsighted individual, extremely high nearsightedness, told his whole life he's not a candidate for LASIK because of his high prescription. And we had a really great conversation about multifocal implants and this new opportunity that you have to be eyeglass or contact lens free. And a lot of people think, well, I'm talking to you, the doctor of optometry, the optometrist. I don't want to talk to you about getting a refractive surgery, a surgery that would maybe not necessitate the need for glasses or contact lenses. Not the case at all. We want you, this is what I always say to patients, I want you to be 20 happy. I don't care what you're using. I want you to be 20 happy. So if that's surgical intervention, which we would absolutely love for you to have, or some other methods or means, we have all the options right here at our disposal. Isn't that right?
Yeah, and it's great the fact that you understand all about it. So by the time the patient is referred to me, they're halfway along the road of understanding the actual options. So you don't get that with every referring office. Where
absolutely,
you're exceptional in the fact that you understand what's going on.
Well, thanks. We appreciate that. So when it comes to glaucoma, for instance, we've talked a lot about the different drops. We've talked about the technologies that are important to be evaluating patients for glaucoma. Now, let's talk a little bit about what happens when the drops don't work. What are some of the things that we can do, or some things that we're looking at now?
Let's first talk about like the interface. We're just talking about cataract surgery.
Yeah.
But 1 out of every 5 cataract patients is on drops for glaucoma.
Wow.
So that you can see how the diseases cross over. So there is something called the eye stent, and it's the 2nd generation eye stent, and they're microscopic little inserts, and maybe you might have a picture.
I think we have a picture right now.
We have a picture for them to show how tiny, tiny they are. And it takes me about a minute or a minute and a half to do that part of the procedure following the 4 to 6 minute cataract surgery. So by putting these little darts, they look like little darts, and through the center of the dart, the fluid escapes the eye and heals that defective drain. So it's kind of like a little bit of a plumbing in the area where the drain is, allows the fluid to escape and the pressure goes down. So you'll either not have to use drops anymore, or maybe achieve better pressure with the drops you're currently using, or maybe you were using 2 or 3 drops, and now you may only have to use 1. So these are very advanced, and right now insurance will pay for them if you're having cataract surgery. In about a year, there's a new version where you're going to use 3 of those darts.
Wow.
And that'll be available for all glaucoma patients. So again, we'll be able to reduce their dependency on those drops that cause dry eye.
That's very impressive. Yeah, and so I'm always trying to do a call to action when we're here on the show. We want to educate you, number one. But number two, if you're someone that has glaucoma, you've not heard of these things, it's a great reason to give us a call and inquire. Is this something that I'm a candidate for? We often talk to patients about their eye pressure in relationship to cataract removal, because we know, and there actually was a study done just last year that showed by removing removing the human lens with a cataract extraction and not even doing what you're talking about, but by simply removing the lens in the eye, it lowers pressure 1 to maybe 3 points.
Right.
And this was called the Eagle study. And so we know that there's some benefit there. And this is icing on the cake.
So frequently you get the 1 to 3 points, and then you might get 5, 6, 7 more points from the eye stent, and the 3 darts for glaucoma. I saw the latest study is from 10 to 13 points.
Impressive.
With a not essentially very non-invasive surgery, as opposed to the typical 1-hour glaucoma surgery that you get from the glaucoma specialist that has all the risk associated with it.
Right.
This is very, very low risk.
Beautiful thing. So if you have glaucoma and you've not heard about this procedure, then give us a call at one of our offices. We can observe your risks and the type of drops you're on and determine whether or not this is something you're a candidate for. Hang on, we'll be right back with a little more information. Hey everybody, we are back. Another great episode of Eyecare today. And if you've missed anything that we've talked about here, you can check us out on the web. You can look up Eyecare today on the web on ssptv.com or our website. We have all of our shows on there, so check it out. We are very excited that you've joined us, and we would love for you to give us a call and set up a eye exam to check and see how your eyeballs are doing. Make sure you're seeing well. Make sure that there's no signs of glaucoma, diabetes, or high blood pressure in your eyes. We are located in Hazleton on the airport beltway at the Big Eyeball. You can't miss us. We are also in Tannersville, Stroudsburg Eye Specialists, and very excited. If you haven't heard, we are going to be in Pottsville. Yes, serving the Schuylkill County and the surrounding region with a brand new location and facility, its own parking lot, easy entrance, and all top-of-the-line technology. Very exciting for that. We've been talking to world-renowned cataract surgeon and LASIK surgeon, Dr. Frank Bucci, who hails from the Wilkes-Barre area. That's where his office is, but he serves many satellite locations, of which we're proud to say ours are some. So thank you for that beautiful partnership and helping all the patients that you've helped in our area. So we were talking a little bit about glaucoma and the advanced treatments that you now offer with these stents, these little, you call them darts almost.
Right. They look like darts.
Yeah, and they're as small as the printing on a penny or a dime. It's absolutely unbelievable. You wouldn't even know it's in there. Beautiful thing, and can really help reduce the dependency on eye drops and decrease the redness and pain and discomfort associated with some of those drops. So very, very important thing to know about. There's something else that's come out just recently. I think you're one of the only doctors in our area that are doing it. And I think we've sent a couple patients to have this done. Can you tell us a little bit about this new implant?
Right, so it's called the Durista, and essentially it's an implant that we insert into the eye that, think of it, the medicine, it's like a little tiny cylinder, and think of all the medicines in the cylinder, and when it goes into the eye, it has a technology where it just slowly releases the medicine. And it'll give you at least 6 months of medicine. So just think how many times you had to use your glaucoma drops in the course of 6 months. And now this goes in your eye. The procedure takes about 10 seconds. It's the quickest and easiest and least invasive procedure that we do. It's hard to even call it a procedure. It's a thread-like needle that's so soft. Your eye is numb, like when they take your pressure at the office. We just, one numbing drop, and we just slide it in there. It's over within 10 seconds, and then you get medicine being eluted or released inside your eye for 6 months, and then lowers the pressure from inside your eye. And the important thing is now you're not taking the drop where the preservatives are hitting your cornea and your conjunctiva and causing all sorts of dry eye and other ocular surface diseases. So this is a tremendous advancement. And you can have cataract surgery and have the eye stents, and then if that dropped you from 3 medications to 1, you might be able to have the Durista post-operatively, and that would get you off all medications altogether. So, and there's another laser we talked about, an SLT laser, which also can reduce our dependency on drops. So between an SLT laser, the eye stents, and the Durista, there's a large majority of you out there who are dependent on glaucoma drops that we can either reduce or eliminate.
And many drops, right?
Many drops.
Many drops. You know, they're on 2, 3, sometimes 4 drops. all the preservatives.
Yeah.
And then the other thing that we don't talk about enough is, and for better or for worse, there's lots of manufacturers of these drops, okay? And as you know, these manufacturers may have a different level of additives or different additives in the drops. The active ingredient has to be the same in a generic medicine. They're not all bad, but some of them are different and penetrate into the eye differently. And so we will see patients and their pressure goes through the roof. Or what's going on? Are you taking the drops? You remember? Bring your drops in, and it's made by a different manufacturer. So not to mention the inherent fluctuations that occur with that. So very important.
And sometimes, like you mentioned that they're different. You can have the drop, the medication itself, but the vehicle that it's in may not be as healthy for the eye as a branded drop by another company. And sometimes there's a fancy word called tachyphylaxis. It means your body or eye gets used to it and it doesn't work anymore. So you got to make sure you're getting checked. You could be using the same drops that worked before, but they may not work anymore.
Yeah. So, I think what patients need to know is that, at Hazleton Eye Specialists, Stroudsburg Eye Specialists, now Pottsville Eye Specialists, glaucoma is something that we care very much about. If you have glaucoma, you've been treated on eye drops for many, many years, and you've not had your cataracts removed, it might be time to, inquire about whether or not you are a candidate for cataract removal and a minimally invasive glaucoma procedure like an eye stent, possibly a candidate for a laser treatment like SLT, which doesn't even change anything in the eye, right? It just stimulates.
A little bit of light goes in the eye,
Yeah.
and the pigment in the eye absorbs the light and then it opens up that drain, and the fluid goes out more, and the pressure goes down.
So some really great options for you. I wanted to just hit on some of the new technologies with cataracts, because before it was could we get you seeing pretty good far away, and then you had to get glasses for everything else. What do you have now as far as the lenses that get placed in the eye?
Well, so we're a center that we've placed 8,000 multifocal implants, and that puts us in the top half a dozen in the world. I just published my latest paper. I have 85 publications between trade journals and peer-reviewed journals, and our latest one was on summarizing 3 studies with 3 multifocal cohorts. So we're a world-renowned, recognized center for studying multifocal lenses. The best lens, my favorite lens, and I think that's most effective on getting people out of glasses, has just added a new feature where they actually neutralize the astigmatism in your cornea from inside the eye, which would mean that after surgery you would be able to see distance and read, but a little bit of leftover astigmatism would blur you a little bit, and we would have to touch that up to take that away. Now, this neutralization of the astigmatism has brought that touch-up range from about 55% down to 15%. So it's a beautiful added feature. I didn't think they could make that lens any better, but they have. So it's just something more sophisticated that we can offer our patients. We're very experienced at it. And our average, if you come in and you say, I want to be eliminated, I want my glasses eliminated, and we use our multifocal lens and we go through our process that we go through, your chance is about 98 to 99% that you will not have any glasses for the rest of your life.
I think I'm going to go back to what I said. Patients ask me because they trust us, they believe in us. We walk them through, their eye care, and we look at them as friends and family. And they ask, when it comes time for surgical intervention, who would you send your mother to? And, I very honestly respond to them, Dr. Bucci. There's no question about it. He's been here since the start of my career, just a short 6 years ago. He's mentored me along the way, and I'm very appreciative of that, and very grateful for all of the passion that he provides for our patients in our area. And so I'm really grateful that he spent this time here with us today, educating all of you on some of the advancements we have when it comes to glaucoma surgery, cataract surgery, and beyond. Give us a call, and we're looking forward to seeing you very soon.